Good evening. I'm Stephen Hunter. Would you take a poison on purpose or have a deadly toxin injected right into your body? Well, if this sounds like a trick question, you're absolutely right. Because although it sounds counterintuitive, in medicine it's done all the time. After all, it is the basis for many vaccines. Well, it's a version of this very same idea that's behind an innovative treatment for a disease that afflicts some 70,000 Canadians. To tell us about it, here's our Montreal correspondent, Lynn Herzeg.
They lurk in bashed and bloated food tins, in poorly canned preserves. Botulism bacteria produce the world's deadliest toxin, a toxin 6 million times more poisonous than rattlesnake venom. Botulinum, as the toxin's called, attacks the nerves that signal your muscles to contract. It gradually paralyzes every muscle in your body until your breathing muscles finally go and you suffocate. But botulism toxin doesn't scare Chantal Dubuc. She's getting a needleful.
Moi, ça me dérange pas parce que ça m'aide au lieu de me droguer.
It doesn't bother me because it helps me instead of hurting me.
What's injected is actually a purified and concentrated botulism toxin sold under the trade name Botox. Doctors inject it into patients' muscles to temporarily relieve uncontrollable spasms. Just like botulism paralyzes your body, Botox more or less paralyzes the problem muscles.
It will loosen those muscles up just like you would if you consumed it by eating food. If you consumed it by eating food, it would spread throughout your body and not have any control. But if you inject it directly into muscles, it pretty much stays in the muscles that you inject.
Doctors have been using Botox routinely for about 15 years now to treat muscle spasms in the eyelids, the throat, the neck, and the face, even to treat musician's cramp and writer's cramp. There have been no major side effects reported, so doctors now feel it's safe to go one step further and use Botox on children with cerebral palsy.
C'est beau, tu fais bien ça. Encore un petit peu, encore un petit effort. Oui.
Cerebral palsy is caused by brain damage that occurs usually before birth, but sometimes during or shortly after. Some children are severely handicapped. Others have only mild symptoms, like some difficulty walking. What they have in common, though, are spastic or tight muscles, because their damaged brains don't send out the normal messages to loosen them. Drug therapies have bad side effects, so 5 years ago, this American doctor was among the first to try Botox instead.
The results have been very good. If you pick the right child with cerebral palsy and pick the right muscles, you can end up with a very good effect.
I will use botulinum toxin if I have a child that has fixed spasticity. But
Dr. Gormley is now touring Canada, telling doctors here about it. Initial studies show most walking children do improve after Botox shots, especially when combined with physiotherapy.
this child here is a 3.5-year-old boy. Before we did the injections, he'd never run in his life, and literally 1 month afterwards, he was running for the first time.
I think it's just starting, and I think it's the tip of the iceberg. I really suspect and expect that this treatment will revolutionize the treatment of spastic cerebral palsy.
Dr. Kenneth Silver is one of the first Canadian doctors to use Botox on cerebral palsy patients.
Some parents, though, actually reacted quite horrifically and thought that this was some toxin or poison and wouldn't hear of it.
But Chantal Dubuc's parents were willing to give it a try. She had her first set of shots 3 months ago. The effects have worn off now, so she's back for round 2.
Okay, mademoiselle, toute fille.
She'll start seeing results again in a few days. This is how Chantal walked before Botox.
Walking on her tiptoes with very tight ankles and tendency to keep the knees flexed or bent and knocking her knees together. Now we can see what her gait is like after we had injected some botulinum toxin into her calf muscles. And we can see her walking with her foot much flatter on the floor, extending her knees better, walking much more smoothly.
Ouais, tout le monde à l'école s'en est aperçu.
Fait que je trouvais ça fun, tu sais, j'étais contente.
Everyone at school noticed a difference, so it's great. I'm happy.
In severely disabled children, like Héloïse Lallier, expectations are more modest. Botox, her parents hoped, would loosen her muscles enough to give her better posture in her wheelchair, which would hopefully prevent pressure sores and spine deformation. Dr. Gaétan Fillon is seeing Héloïse for the first time since injecting the gluteus muscle in her left buttock.
Ooh. Very good results. It's more relaxing.
Big improvement.
Big improvement, so this direction, no problem at all. We'll go that way. My God. I'm surprised myself.
She doesn't hurt anymore. Her muscles were pulling all the time, every time she was sitting down. Even when she was lying down, we had to do it a special way so we won't hurt her legs. So now she doesn't hurt anymore. So that's a big improvement.
And Botox works as a dress rehearsal for surgery. It mimics the probable result of an operation to lengthen that muscle.
And then we go to surgery on that muscle, and we are pretty sure that we will get the same good results. If
This time permanently.
that time permanently, so we know that good surgery. We had another kid which seems to be the same. We did the same thing and it almost no effect or even getting worse. In that case, we know that that surgery should not be the good one to do.
There was an uncertainty because the surgery, we could have effect that we didn't like. But with the Botox telling us, well, if we do that muscle, especially that muscle, we will have the same result. So in that way, why not? Let's go. It's like we were saying, my husband and I, it's like trying a car before buying it, in a way. So we're gonna buy the car.
Botox may also offer parents a choice they didn't have before. Sometimes the surgery their child needs is a rhizotomy, a grueling 8-hour operation where doctors loosen the muscles by cutting nerves in the spinal cord.
I could certainly foresee patients who will respond so well to the Botox that if we did consider rhizotomy before, we would not go ahead with it and maybe continue with the Botox because the effects of that treatment were so dramatic.
But like many drugs, Botox has a downside. It might stop working. Up to 15% of adults eventually become immune to Botox, and doctors suspect the same is probably true for children. Yet that aside, many doctors see Botox as the most promising treatment for cerebral palsy in a long time. For The Health Show, I'm Lynn Herzeg.
When we return, have